The unknown. Vitamin that is clogging your arteries. Today I have great pleasure in speaking with you about calcium. This topic has interested me since my residency days because we all know that calcium seems to be what is clogging the arteries. So I have a special interest in calcium and, alongside it, in vitamin K2. What is vitamin K2? It is a vitamin that nobody knows about. Vitamin K maybe, but K2? So today, I'm going to teach you about calcium and vitamin K2. And I will explain why this subject interests me so much, because I believe this is a very important chapter in understanding what is causing the blockages in the arteries of the body. So let us dive right into this subject. 9% reduction in cardiovascular risk per dose. There is a study called the EPIC study, and it showed that for every 10 micrograms of vitamin K2 in your diet, there is a 9% reduction in cardiovascular risk. I will take that any day. Show me which of my medications can do that. Some, very few. In the EPIC study, there was a direct correlation. The higher your intake of vitamin K2, the lower your cardiovascular risk. So if you are consuming 40 micrograms, that is 4 times 9, which means almost 50% reduction in cardiovascular risk. All references are listed, and this was an incredible study. But what did a second European study discover about calcification in the coronary arteries? The answer changed the way I treat my patients. The study published in 2009 that nobody showed you. There was another study conducted in Europe that clearly showed the amount of coronary calcification. You already know that I perform coronary scan exams on all my patients to check for coronary calcification because coronary calcification indicates that you have atherosclerosis. There is a direct correlation with mortality and with heart attacks, and this is very well established. Now, this study showed that there is a direct correlation between vitamin K2 intake and coronary calcification. A direct and clear correlation. This is a beautiful study, published in the journal Atherosclerosis in 2009, showing that patients with low vitamin K2 intake had the worst coronary calcification, while those with the highest intake had the least amount of coronary calcification. Bone density, fractures and elasticity. What the Dutch study revealed. There was yet another Dutch study that looked at 180 micrograms of MK7. MK7, that is the vitamin K2 preparation we use. And as I mentioned before, it comes from fermented products. The study showed not only reduced cardiovascular risk, but also that these patients had much better bone density, fewer fractures, and greater bone strength. That was a study from 2007. Then, additional studies were conducted and showed that patients who received vitamin K2 supplements had better pulse wave velocities and greater carotid artery distensibility. What exactly does it mean to say that an artery becomes more distensible? And why does this have everything to do with your blood pressure? Why stiff arteries raise your systolic pressure? What does this mean? It means that vitamin K2 is improving the elasticity of the blood vessels. How does it do this? Well, obviously, if there is less calcium accumulation in that arterial wall, in the smooth muscle, as I explained before, that artery is going to be more distensible. And if it is more distensible, then what? Well, what happens is that systolic pressure will be lower, because when the heart pumps into a rigid tube, the sustained pressure will be higher, since there is nothing to accommodate that ejection volume. But when there is more distensibility, it means there is more compliance in the blood vessel. Because of the lesser amount of calcium, it is less rigid, and you will get a lower systolic pressure. And we know that systolic pressure has a direct correlation with coronary artery disease, cardiomyopathy, congestive heart failure, and total mortality. Diastolic pressure and the double blow that destroys the heart. So what happens to diastolic pressure? The diastolic pressure of patients who receive vitamin K2 supplements also improves, because you do not want a very low diastolic pressure. A low diastolic pressure decreases coronary perfusion, and coronary perfusion occurs precisely during diastole. So what happens is, if you are deficient in vitamin K2, you are going to have a high systolic pressure because of the non-distensibility of your stiff tubes, your aorta, and everything else. and you are going to have a lower diastolic pressure because there is no aortic recoil. Since diastolic pressure is caused precisely by aortic recoil, it is a double blow. You do not want stiff arteries. You do not want calcium. And by the way, this process of arterial stiffening and loss of elasticity begins in your 20s. I hope I have your attention here. It begins in your 20s. When you reach your 50s and 60s, if you have not taken care of your vasculature, you will have stiff arteries and calcification. You may not have had a heart attack yet, but your physiology is being set up to have a stroke, a heart attack, or heart failure, which is the leading cause of mortality in the Western world. But did you know that it is possible to slow down this accumulation of calcification with supplementation? There is a study that shows exactly what happens when you do this, how the calcification curve can be flattened with K2. Many studies have been conducted. There is yet another study also with vitamin K2 supplementation. They took a group of patients, administered vitamin K2 to them, and found that the increase in coronary calcification can be attenuated. The control group showed continuous calcification because it is very easy to follow coronary calcification scores. And here is a clear image of this, showing the accumulation of calcium. Just to remind everyone, this chronic calcification was attenuated. You can make that curve flatten with vitamin K2 so that there is no further accumulation compared to the control group. The group that received the supplements had much less calcification accumulation. So any opportunity to decrease the amount of coronary calcification and accumulation in your arteries and to improve the elasticity and distensibility of your vessels, take it. Natto, Gouda, and kefir, the foods with the highest K2 concentration. That is why I give vitamin K2 to my patients. And the diet also needs to improve. What to eat? Fermented foods. Fermented foods. The Japanese consume a lot of natto, N-A-T-T-O, which is fermented soy. If you have a taste for it, you should consume it, because it has the highest concentration of vitamin K2. Next come the hard cheeses, such as Gouda, hard cheese, with a very high concentration of vitamin K2. Then come other cheeses, such as French cheeses, which have a lot of vitamin K2 because they are fermented products. The bacteria produce vitamin K2 during fermentation. Kefir also makes this list, as does sauerkraut, and they have quite a bit of vitamin K2, but much less than the first items I already mentioned. And if food sources are not enough for you, what happens to those who already have established calcification? Meats, eggs, and the one contraindication you need to know. Our regular meats contain MK4, and our eggs contain MK4. If you have free-range chicken, free living, they will also have vitamin K2, but they need to be free-range. They need to be eating what they would normally eat in their natural life, not the feed we are giving them. The same applies to eggs. Any opportunity I have to go that route, that is the way to go. And in the worst cases, patients who already have some calcification or are at very high risk, I also prescribe vitamin K2 supplementation. So is there any downside to giving vitamin K2 as a supplement? There is. It affects the PT-INR if you are taking Coumadin. So if you are taking Coumadin or warfarin, you need to make sure you are testing your PT-INR, because high doses of vitamin K2 will affect it, and this has already been demonstrated. Other than that, I have not seen any other downside to taking vitamin K2 supplements. How much vitamin K2 do I recommend? 200 micrograms of vitamin K2 per day. Diabetes, osteopenia, and arterial disease. The connection nobody was seeing. So let me talk a bit about something I mentioned at the beginning. I said there was a correlation between my patients with diabetes, osteopenia, and coronary artery disease. Let us see if there is a connection here. We know that vitamin K2 also affects insulin sensitivity, and I will show the references for that as well. If we induce vitamin K2 deficiency in a patient by altering their diet, it produces insulin resistance. When you supplement them with 200 micrograms of MK7 vitamin K2, insulin sensitivity improves. And recalling my earlier conversations about insulin sensitivity, these patients who have insulin resistance, by simply giving them vitamin K2, I am also improving their insulin sensitivity. But why does this happen? What does vitamin K2 have to do with insulin? The answer lies in a surprising place in your body. Saliva, teeth, and the dentist, who cured cavities without pulling a single tooth. Why is this so? What does this have to do with the subject? Well, vitamin K2 is found in high concentrations in certain parts of the body. In saliva, there is an extremely high level of vitamin K2. What is it doing in the mouth? Well, guess what? I have teeth. Vitamin K2 in saliva causes me to deposit dentin. So the higher my vitamin K2 levels in my saliva, the better my teeth will be. Does this make sense now? If you are deficient in vitamin K2, you will develop tooth decay. This has been directly proven. The dentist Weston Price clearly demonstrated that he was curing the worst tooth decay by providing vitamin K2 to patients. He called it Factor X at the time. He did not know it was vitamin K2, but he cured the worst dental cases in these people. He did not extract teeth. He simply gave this to patients and suddenly all the cavities improved. This is incredible. It truly is incredible. From the pancreas to insulin, what K2 does inside your metabolism. So vitamin K2 in saliva is there for a reason. The highest concentration in the body is in saliva because it wants to maintain good dentin. Second, it is in the pancreas. There is a very high concentration of vitamin K2 in the pancreas. What does this have to do with the pancreas? It has to do with insulin sensitivity. That is what it has to do with. So when you give vitamin K2, you are boosting pancreatic function and preventing that dysregulated hypersecretion of insulin. The incretin response is attenuated when there are good amounts of vitamin K2 inside the pancreas. And what about joint diseases? I think I already touched on this. If you do not have vitamin K2, you will not activate the matrix proteins in your bones, and therefore you will develop osteopenia. There are many references to this. But what if I told you that vitamin K2 may also be protecting your brain against Alzheimer's? Alzheimer's and blood flow in the brain, the still little known connection. Now there is one more, Alzheimer's disease. What does this have to do with it? Well, again, we are not 100% certain, but remember that the vasodilatory capacity of the capillaries in your brain is very important. You see, when I perform functional MRI studies, you observe blood flow in different parts of the brain, and instantly flow increases here and decreases there. That is my brain activity. How does this happen? Through vasodilation. You vasodilate, you vasoconstrict, you vasodilate. This capacity, this automatic vasodilation and constriction of the microvasculature, is controlled by vitamin K2 in the smooth muscle cells of your blood vessel. 30% less cancer, and what happens in the kidneys without K2. An additional study showed that, in relation to cancer in general, a massive study demonstrated a 30% lower cancer risk in patients who had high levels of vitamin K2 or its equivalent in the bloodstream. And as I mentioned before, I mention again, natto, hard cheese, butter, liver, and cod liver oil have very high concentrations of vitamin K2. And regarding prostate cancer, there was a study showing that there was less prostate cancer and less cancer spread in patients with the highest levels of vitamin K2 in the body. And what about osteodystrophy in patients with kidney failure? One of the biggest problems with these patients is that they develop calcification of non-bony structures. So when they come to me, I see the coronary calcium score extremely high, the carotid arteries are calcified, the aorta is calcified, the aortic valve is calcified, and these patients used to receive calcium supplements. We no longer give them calcium because mortality is very high, and we believe this is due to two factors: vitamin D deficiency and vitamin K2 deficiency. And why does vitamin D appear in this story? What does it have to do with all of this? Vitamin D absorbs calcium, but K2 decides where it goes. I need to talk about vitamin D now because to get optimal functioning of your vitamin K2, you also need vitamin D. Vitamin D goes to that same matrix protein, and then comes K2, and they work together on the matrix protein. So you need good vitamin D levels as well. That is why we also give vitamin D to our patients. The role of vitamin D in the body is twofold. First, it increases calcium absorption through the intestine. That is what vitamin D does. But vitamin D does nothing more with calcium after that. That work belongs to vitamin K2. The role of vitamin D is simply to absorb calcium into the body. The destination of that calcium after, whether it goes to a vascular structure or to the bone, is not determined by vitamin D. Why everything you eat has vitamin D, and yet there is an epidemic of osteopenia. That is why, if you have a patient with osteopenia and you simply give them vitamin D, you are not really helping. But if you look around, everyone is taking calcium supplements and vitamin D supplements, but they are not taking vitamin K2 supplements. This experiment has lasted long enough. Despite this, look, all your foods are supplemented with vitamin D. There is vitamin D in everything, even in your orange juice. Practically anything you pick up is supplemented with vitamin D. And yet we have this entire epidemic of 25-year-olds coming to me with osteopenia. I am surprised. You are drinking everything with so much vitamin D, with so much calcium, and you still have osteopenia. Because they do not have the right chemistry. They do not have vitamin K2. And by the way, vitamin K2 deficiency has also been associated with fertility problems. And in children, the development of the face, the arch, the nose, is also related to vitamin K2. But what does vitamin K2 have to do with the shape of a baby's face? The answer will surprise you. Narrow jaws and blocked airways from childhood. Weston Price was the one who discovered this clearly. Mothers and children deficient in vitamin K2 had premature calcification of the facial cartilage, of the nasal bridges, and as a result developed small jaws and upper airway obstruction in these children. So the question is, why do these children develop this? Because they did not develop the face properly due to premature calcification of the cartilage. Over time, everything closes up, and that is that. The cartilage can no longer expand because it has been calcified, so narrow arches. And by the way, they say you can detect this even in the newborn, that baby likely has vitamin K2 deficiency by the way that facial structure is forming. This is also a very exciting area, but it shows that the mother's nutrition is extremely important during pregnancy to avoid narrow jaws, mouth problems, and all these issues. Diseased gums, small dense LDL, and the path to stroke. Regarding tooth decay, I already touched on this subject. The very high levels of vitamin K2 inside your saliva need to be maintained. And by the way, you know that patients with severe tooth decay can develop low-grade endotoxemia because the gums become compromised, creating a direct route for tiny bacterial products to enter your bloodstream. These products, called lipopolysaccharides, enter the bloodstream, and they are what displace the cholesterol from the LDL molecule and create small dense LDL. And you know that it is the small dense LDL that causes atherosclerosis, not LDL itself. It is when LDL becomes small and dense because it picks up endotoxins along the way, since endotoxins cannot float freely in the bloodstream. So we always try to identify the cause of small dense LDL and treat that point to improve patient health. So gum disease is very important. And mouthwashes with all those chemicals are the worst thing you could do, because you are simply eliminating the good bacteria from your mouth and replacing them with the most resistant ones that exist. And then you wonder why there is more tooth decay. And these mouthwashes do nothing for bad breath, because bad breath comes from something much deeper. That is why I am not in favor of these mouthwashes. The best thing to do is to take a good probiotic and take vitamin K2 supplementation, and you will have a much better oral bacterial flora. It improves, and of course your dentin will also be very good. There is data also showing the direct correlation between tooth decay and strokes. But the last connection I will show you links everything we discussed today to something even bigger about calcification and the heart. The question. Every cardiologist should be asking. To close, I want everyone to know that vitamin K2 is probably a little-known molecule, but probably extremely important for our physiology. I think when I, as a cardiologist, see all this calcification in the coronary arteries of my patients, I'm always asking the question, why? Where did this calcium come from? What is it doing where it should not be? And I believe these are the starting points that I now apply. I now put all these patients on vitamin K2 supplements.
And because many of you have been asking me, Doctor, why are you prescribing vitamin D and vitamin K2? I came here because I have a blocked artery. Well, that is the answer. If you enjoyed this video, then this one here I strongly recommend to you. But if you want to see the complete series,